How often is frequent urination for bladder health? Imagine your bladder as a small storage tank that holds urine until you're ready to go. Most adults typically urinate about 6 to 8 times in a 24-hour period, which is considered normal for maintaining bladder health. This usually includes waking up once during the night to urinate, especially in younger adults. Urinating between 4 and 10 times a day can also be normal, as long as it doesn't interfere with your daily activities or cause discomfort. The exact number varies depending on how much you drink, your diet, age, medications, and overall health. When we talk about frequent urination or urinary frequency, it generally means needing to urinate more than 8 times in a day or waking up more than twice at night to go. If you notice this happening regularly, it could be a sign of various bladder conditions. For example, overactive bladder causes a sudden urge to urinate often, even if your bladder isn't full. Urinary tract infections can also increase frequency, along with conditions like diabetes or, rarely, bladder cancer. It's important to remember that while frequent urination can be a symptom of bladder cancer, it is much more commonly caused by less serious issues. Several factors influence how often you need to urinate. Drinking a lot of fluids, especially caffeinated or alcoholic beverages, can make you go more often. Certain medications called diuretics increase urine production. As people age, their bladder capacity tends to decrease, leading to more trips to the bathroom. Pregnancy can also cause increased urination because of pressure on the bladder from the growing fetus. From a bladder health perspective, paying attention to changes in your urination habits is key. If you suddenly start urinating much more often or notice other symptoms like pain, blood in your urine, urgency, or difficulty urinating, it's important to see a healthcare professional. These signs can indicate underlying issues that need medical evaluation, including the rare possibility of bladder cancer. Early diagnosis can make a big difference in treatment and outcomes. Maintaining good bladder health involves staying well hydrated, avoiding bladder irritants like caffeine and alcohol, and not ignoring the urge to urinate. However, it's not advisable to limit fluids excessively to reduce urination, as this can lead to dehydration and other health problems. If you notice a significant change in your urination pattern or develop new symptoms, consulting a healthcare provider is the best step. They can perform tests and determine the cause, guiding you toward the appropriate treatment. In summary, urinating more than 8 times in a day or waking up more than twice at night to urinate is considered frequent. While this can be normal for some, it might also signal an underlying bladder issue. Changes in your urinary habits should always be taken seriously, and seeking medical advice ensures you get the right care. Early evaluation is especially important if there's concern about bladder cancer, as catching it early can improve treatment success. Remember, everyone's body is different, so personalized medical advice from a healthcare professional is always the best way to stay healthy.